Yeah, this is great. If you've ever met a person with hemophilia who has it on his app, on his phone, they're always going around saying, "Hey, see, I'm at 15%. I'm at 12%. I'm at 20. I'm at 26." They really enjoy it, and it shows the value, the personal value to them, and it also gets them to draw links between their factor levels and their activities, and to know when they bleed. So I think it has huge potential. We invited, the organizing committee invited Mark Skinner to make this presentation that I'm about to make. He's the lead investigator for PROBE, and if I could have those slides. He was doing another event today and would really like to have been here. So he asked me to do it instead. So it won't be as good, but we'll move on. So hands up, has anybody, who has filled out a PROBE survey? Some, okay. Who knows what PROBE is? More. So, but less than half. Okay, so I'll tell you, it's my job to tell you what PROBE and my PROBE is. So it's a study, and it includes a 28-question survey. And it's really a service to hemophilia patient organizations around the world, and it reports patient-reported outcomes. None of the stuff we were talking about before, ABRs or factor levels. It's the stuff that patients can report. So the idea behind it is we can't just use anecdotes to convince payers that innovative technologies are good. We need to provide data. And more, they don't just want the medical data, they want the patient-reported outcome data. So we had to go back to patients and say, well, what's important to you? What is the outcome? And nobody said annual bleed rate, not one. That was not an answer from anybody. And so we had to put together what were the things that people thought important. Well, pain, of course, was first, both acute and chronic, and independence, their ability to function, to live a normal life, to be educated, to work, their family life, mobility, which is related to joint health, of course, and we also added to, as an extra tool, an already validated device, the EQ5D, which we could then compare. So, interestingly, this was developed by people with hemophilia A and B, with people with hemophilia B. In other words, they were telling us what was important. And it was for people with hemophilia B, for the patient organizations. And in the phase 1 and 2, we had 23 countries involved, over 2,000 surveys gathered. And these are really the experimental phases. And we're just now in 2019 moving on to phase 3. The chair will tell me when to stop. Phase 3 is 35 countries, and it's translated into more than 50 languages, which is considerable. We fortunately had some experts to work with, because we weren't the experts in the field of validation of surveys. And so we did have a lot of excellent people to work with us. And this is not my area, but it has been validated in terms of feasibility. In other words, it was easy to administer. The face validity of the questions, test, retest. In other words, if you give the same survey at different times with different tools, computer versus paper, will the answers that should stay the same, and the answers that actually might change. And then all the psychometric properties, and also was validated for across countries and languages. So it's gone through that. And it's been published for full manuscripts, and then many abstracts and posters presented at all of these different conferences. So really measures, personal information. So it does measure, sort of the basic demographics of hemophilia A and B. It also measures other health problems, hemophilia-related questions, and then it adds on the EQ5D. It's really notable that anybody can fill out this survey, because we want a control group of people who living in the same city, in the same country, with the same demographics, to be able to compare them to what is their level of health in terms of all of these different variables compared to people with hemophilia. We also have to report information. So this is just one of the printouts of what we provide to the countries that participate, to the patient organizations that participate, based on all the different questions that I've just measured. And this is really quite a cool tool. This is an interactive tool. It's a bit hard to see, and I haven't got it actually linked up to the internet today. But you can put in all the filters. So hemophilia A, B, severe, mild, moderate, age, country, inhibitors, non-inhibitors, all kinds of different factors. And then you can measure all the outcomes by playing with those filters, and seeing what the results are. You can compare country to region. You can compare hemophilia A severe to mild. No end to the number of ways you can play with the data, and that we put that in the hands of the countries themselves, the patient organizations themselves, so they can develop arguments to take to their payers, showing that perhaps the adjoining country, which has introduced low-dose prophylaxis for children, is getting way better results. How is the questionnaire administered? Well, it's on computer, on tablet, and on a phone. And that's my probe. So this is where we move into the really cool and new part of this, is that you can do probe on your phone. And if you're in Canada, you can log in with your MyCBDR. This is within days of going online, right, Alfonso? We hoped it would be today, but it's not. It may be next week. So then you can also log in through your MyCBDR, which makes it, you're still anonymous in terms that you're not named, but the research can follow you over time, you as an individual, because you log in with your MyCBDR identifier, so you can see how your quality of life will change over time, and we can do research on that. Whereas if you just log in as a guest, we'll have data for the country, but it won't be linked to people. So that's the login for through MyCBDR. Here's an example of a question. One of the early questions is gender. Questions on type of hemophilia. Carriers are invited to complete the survey. And there's one question here on daily activities. Putting on your socks, taking off your socks. It gets right down to the nitty-gritty. So what happens to the data collected by probe through CBDR? So the raw data remains under the control of the probe study group, and that data is housed at McMaster with all of the CBDR level security. Individuals who complete the questionnaire can actually get a PDF of their survey, so they can keep that and do it every year and see how things change over years. So there's a personal value for the person doing the survey. And then individuals and groups, by groups I mean hemophilia organizations, research groups can request aggregate data for research and advocacy purposes. So the group would then study, just like the CBDR data group looks at requests for data. So who should complete the survey? Well, or why should they? Well, this is certainly going to provide CHS and also other organizations around the world with valuable data on patient-reported outcomes to use for health technology assessments, access to improved comprehensive care, and access to innovative therapies. And why should they use it with MyCBDR? Well, it gives us valuable data on, again, that can be used in advocacy, yes, but we can follow results from year to year for the same people. So you can take a group of 500 people and see how those particular people are changing over time. If you saw at the front desk or at our booth, you can pick up the MyProbe app, because within days you'll be able to get the app on both Android and Apple. And this explains everything about it. And you get to know it. And we do have, I think we have a question, if we can come up with the question. So this is a question for people only with hemophilia A and B. Can we get it up on? There we go. And yep, Complete the probe survey by signing in through My CBDR, so your answers can be followed over time. Complete it anonymously. Complete it on paper at CBS meetings. Not participate or have to think about it. Please vote. Okay, we'll stop there. So I'm happy to see that no one said not participate. So I think this is really a valuable tool for, I think you think it's a valuable tool. I've convinced you. I've done my job. Okay. Do we have another one? Oh, no, that's it. We only have one question. So this is the probe study group, and I mentioned Mark is our lead investigator. Several people are here. Dr. Iorio is here. Chatri's not here, is he? No. And I'm sure if you've been around the hemophilia world, you recognize some of those names. But in Canada, the two people are Alfonso Iro and myself, and we've just added Chatri, who works at McMaster. And we've also identified two links between CHS and the chapters back to the probe group, and that's Kathy Laude from our National Board of Directors and Matthew Jackson who's very involved in CHS too. Those are the people, if you're from chapters, please talk to them. They'll help you with getting access to this, perhaps at a chapter meeting. And those are all the funders and participating countries. And that's it. Thank you.